Are you pregnant? Do you have a rash on your body, like on your belly and on your legs? And are you itchy? Then you may have something called PUPP. P-U-P-P-P. What is PUPP? PUPP is simply an abbreviation for Pruritic, URTICARIAL, papules, and plaques of pregnancy. So what does all that mean? Pruritic refers to, or relating to, or marked by itching. Urticarial refers to hive-like rash, usually round and red bumps that itch intensely. Papules refers to small, raised, solid pimple or swelling, often forming part of a rash on the skin. Plaques refers to thickened or flat areas of the skin, and pregnancy refers to or related to being pregnant. PUPP can also be called by other names, such as polymorphic eruption of pregnancy, and less common other names such as Bourne's toxemic rash of pregnancy, nurse's late onset prurigo, and toxic erythema of pregnancy. The good thing about PUPP, although it is itchy, uncomfortable, irritating, annoying, and may not be pleasant to look at, it is not dangerous to the mother or the unborn baby. In addition to the different names of PUPP that describe the same condition, PUPP can also look like another rashy and itchy skin condition called pemphigoid gestationis, or PG for short, which is not the same. To make it even more difficult to differentiate, PG is also common in the third trimester, but usually presents in the second trimester of pregnancy. PG is also different than PUPP in that it also can occur at any time during pregnancy, besides the second and third trimester. Although PG was previously called herpes gestationis, there is no relation to the herpes virus. PG does have the itchy hive-like rash, and the difference between the two, PUPP and PG, is determined by a biopsy. Whereas PUPP poses no risk or complications to the mother or the baby, PG can cause issues such as premature delivery, small for gestational age babies, rash or blisters in the newborn, although that occurs in less than 5% of babies, increased risk for infection, and excessive loss of fluid. Although it can cause all these issues, it does not cause an increased risk of fetal death. One more thing, PUPP and all the associated other names, as well as PG, are not to be confused with ICP, or intrahepatic cholestasis of pregnancy. ICP, which also has intense itching, but with no rash, and ICP is very dangerous for the unborn baby. For more information on ICP, see my video titled Got Itch, which describes and discusses about ICP. Real quick, my name is Nurse Master Charlie. Welcome to my YouTube channel and my nursing channel. I am a registered nurse, and on my channel I talk about and share about nursing school related topics and tips, as well as health related topics, tips, and information. Now back to PUPP. It is unknown what causes PUPP. However, it is thought to be due to the rapid stretching of the skin, which can trigger the rash to begin. Statistically, PUPP occurs in about 1 in every 150 to 160 pregnancies. PUPP generally occurs in the third trimester near the 35th week of gestation, and in rare cases can occur in the postpartum period. PUPP is more common in a woman with the first pregnancy, in Caucasian women, in a woman with multiple gestations, possibly due to the increased stretching in the skin, in women carrying a baby boy with an increased risk of a 70% chance, also pregnant women with maternal hypertension or high blood pressure, and faster than usual weight gain. Although these are common risks, women can also experience this rash without any risk factors. Signs and symptoms of PUPP. The signs and symptoms of PUPP is an itchy hive-like rash of small, pimple-like, blister-like spots that appear on the skin and in the stretch marks. This can lead to plaque-like formations, kind of like plaque psoriasis, but they can spread to the legs, thighs, buttocks, breasts, and arms. The most common symptom is the itchiness associated with the rash. The itchiness is reported to be increased and more severe at night. Diagnosis. PUPP is diagnosed primarily through your medical history, current gestational age, and by physical examination of the rash. To rule out other disorders such as PG, as mentioned earlier, a biopsy may be performed. However, more commonly, lab tests are obtained such as a complete blood count, liver function tests, a metabolic panel, serum cortisol test, and serum HCG test. Treatment. The cure for PUPP is delivery of the baby, with the rash subsiding within approximately 2 weeks. Your doctor may prescribe pharmacy-strength medications, but symptom management possibly can be obtained with a cool wet compress over the skin, moisturizers, topical steroids such as 1% hydrocortisone cream, antihistamines such as Benadryl, and itch-relieving baths such as oatmeal. But always check with your doctor if you are going to take over-the-counter medications, whether orally or topically, to make sure it is safe for you and your baby. Things to be aware of with PUP. Although PUP poses no long-term risk for you or your baby, a baby could be born with a mild form of the PUP rash. For the mother, although there is a possibility of having PUP in future pregnancies, the overall risk of having PUP is actually decreased. That's some good news for you. If you found value in this video and learned a little something about pruritic, urticarial, papules, and plaques of pregnancy, or PUP, please be sure to give this video a like, and please be sure to share this with all the women you know who are pregnant and or are desiring to become pregnant. Because the more who know about this topic, the better. If you are interested in health information and nursing related content like this, I'd like to invite you to subscribe and be part of my nursing channel. Also hit the notification bell so you can be made aware of when I release new videos. Please be sure to check out my many other nursing topic related videos. And if you didn't know, I am a nurse and a musician, and one form of education I create is educational music. You can find my nursing and health related educational music lyric videos here on YouTube. And you can also find my songs on almost all music streaming platforms such as Spotify, iTunes, Apple Music, Pandora, etc. to take my nursing education music with you on the go so you can learn while you listen to music. Also, please be sure to check out my nursing blog on my website, www.nursemastercharlie.com. I'll also leave links in the description. So until the next video, I'm Nurse Master Charlie. Go save lives and make a difference in someone's life. God bless and goodbye. So if you want to learn about ICP or intrahepatic cholestasis of pregnancy, which I mentioned a little bit about earlier, click this video here.